So get the importance of determinants of health into our students, whether we're teaching them or just talking to them and communicating with them. It's about making them or helping them to understand that the determinants lead to their responses and their patterns that they just exhibit in their normal life. So as a simple example, we might ask them to take their shoes off and they put their shoes on, and all of them will start automatically with one particular foot, and then we'll start to say to them, well, why did you do left foot first? Why don't you do right foot first? And just getting to think about things that they do that are just a response or just a normal pattern. But then we'll start to talk about things a bit more related to health. And an easy one to do, because they don't understand how broad it is how they deal with stress. So most kids, if you ask how do you deal with stress, I eat lots of chocolate, or I go bash something up, or I go for a run. I don't understand like the powerful of mindfulness or meditation, those sorts of things. So if they can understand why they're stressed in the first place, and a big cause of student stress is their work, and it's because they value what they put out in front. So I often say to other teachers, school is a very... School puts the pressure on because kids have to fail in public. So if a kid fails a subject, everyone knows about it, because we have to put up all these rank orders, we have to give them back their grades. There's no way to hide your failure. So the good students want to put their best work across, and they hold back all the time trying to fix that last little thing before they hand it. So I'll talk to them about how much they value their work, and the value is the determinant that they have on it. And because of that value, that's what's building or contributing to their particular stress. So instead of just going for a run when they're getting stressed, we work with them about, well, how do we deal with you placing so much value on your particular work? Is there a way we can address that so that you're not getting stressed in the first place?
So in clinical psychology, we do something that's called a formulation. And that's basically getting an understanding about what are the predisposing factors, whether they be medical factors, psychological factors, social, behavioural, and how they link into what's currently happening for the person. So we really have to consider all those different elements to then try to explain and then treat. So it's a connected process that you cannot neglect any one aspect of that formulation or that picture of what's going on for a person. So when thinking about the different factors that contribute to that picture, there must be a consideration to medical, behavioural, psychological and social. And as psychologists, we can't neglect any one of those. Okay? We know that many mental health conditions have a biological or genetic background, some more than others. But we also know that oftentimes there's a trigger or something that's happened in somebody's life, whether that be social, breakdown of a role or a trauma, that triggers off that current episode, for example. So you can't have one without the other, really. And it would be, you wouldn't be doing the best for the patient or the client if you were to neglect anything. Now, we're probably biased more as psychologists towards that behavioural or perhaps even a bit social, because our treatment processes rely on understanding their behavioural patterns or thought patterns. While we're not neglecting the medical, we are probably stepping in more on that, what's going on for you in your life and how can we treat that on a talking therapy or changing your behaviours. Which means we're probably biased towards looking for things that they've done behaviourally or happened to them socially rather than medical. But I have to say, there's a lot of medical complications that can create psychological conditions. So it's tricky, but being really, you kind of have to be really comprehensive, but focus in on what's going on for the person to get the best outcome for them. Yeah.
So often in the public system, we get a lot of women in who have really poor social situations. So whether that's, come from a domestic violence relationship or purely don't have the financial means to get by, or are involved with drug users outside. They may not personally be a drug user, but a lot of people that they associate with are. So all of those things are massive risk factors and barriers to my caregiving. I just assume that people come in at a healthy level because as being pregnant, there's nothing actually wrong with you. You've just got a baby inside, you know. You should be physically well, but all of those little things really impact on the way that you give care. First of all, you've got to take judgment out of the situation, and then you need to provide them care based on what their normal is. So yeah, I'd say it's highly important that you bring in those risk factors and make an assumption based on that particular person, not I saw 3 women who had social issues at home and they're doing fine now, you know, you'll be right 2 in 2 days. That's not always the way it is, so you need to bring in other resources to help with that too.
I always think for myself that my expertise, I say to my clients, you know, starts here and ends here. So I have some understanding of how eating disorders can affect someone physiologically, but it's not my expertise. So even though I might feel like the client's quite engaged cognitively or psychologically in a session, I need to make sure at the same time that their medical health isn't being compromised and they're not just coming and seeing me and that whole part is being ignored. So needing to kind of work with the GP and make sure that even if treatment feels like it's working, that it's what's actually best for the client medically. And I suppose we'll always have this agreement that the medical priorities sort of come first. So you can be really engaged in treatment and liking what we're doing, but if you know something's going on for you medically, we need to stop treatment and focus on that. So I guess in terms of how does it improve outcomes for clients, I guess my real concern about treating eating disorders, in particular in a private practice setting without medical practitioners on board, is that there's a high likelihood that something could go wrong if we're not medical practitioners and we're not getting that support and having that monitored on a regular basis. So we know that we're keeping people well and able to receive treatment in the community.